Microneedling is with this device. It's called SkinPen. Control the depth all the way from 0.5 to all the way up to 2.5. So we're going to start today. Squirt a little bit of, pretty much just glycerin is all it is, just for slip. We're not really microneedling anything into her skin today. All right, so what we're doing is we're actually creating little micro channels in the skin. What the microchannels are actually doing is you're stimulating collagen growth and hyaluronic acid production in the skin. So when you create hyaluronic acid production in the skin, you're bringing in a little bit more moisture to the skin. And then the collagen is kind of a funny thing. It actually regenerates after it's been traumatized. So what we're doing is we're creating a controlled injury, which in turn is creating that collagen. So she's got a little bit of bleeding here, and the bleeding actually occurs because we are creating little micro channels, micro injuries to the skin. It doesn't bleed everywhere. She's got a little bit more bleeding here. Usually you get a little bit of blood when you go a little bit deeper in it because I want to get down to the base of the wrinkle. So what is so cool about this device, you can actually get really, really close next to the eye with this. Lasers and fractionated lasers, you have to stay away from the orbital bone. Down here, these little fine lines and crow's feet that you can get super, super close with this. Makes it way different than a fractionated laser. So really what you can expect with microneedling, you have to do a series of 3. So collagen takes about 30 to 90 days to actually regenerate in your skin. So do a series of 3, 1 a month for about 3 months. Sometimes you want to go a little bit longer, maybe do 4 months, but usually 3 months is good. After the first one, your skin's going to look tight, bright. It's just, the wrinkles are going to just not show as bad, but then it's essentially going to go away. You'll end up coming back in for another treatment, and that's going to be in a month later. And your skin then improves after that because it takes that 30 days for the collagen to actually start kicking in. So once it starts regenerating and rebuilding itself, that's when you'll really start seeing something. After month number 3, you really see a big difference in your skin. Fine lines and wrinkles are less. Pores are amazing. They're almost gone. This is great for acne scarring. Anybody that has a little ice pick scars from having severe acne when you were a kid, this flattens it right out. It's also great for scars, C-section scars, also a little bit of wrinkles in the neck. It smooths those wrinkles out tremendously. So I want to talk about petechia. Every once in a while when you microneedle, you get some petechia, which is essentially just pooled blood underneath the skin. You get it in thinner areas. It's either going to be around the eye up here, or it's going to be up here on the bridge of the nose, or even in a place where you really have went really deep trying to get to the base of that wrinkle. This lasts for anywhere between 24 to 48 hours. So what I'm looking for as an end result as an esthetician is I want overall redness of the skin and a little bit of blood. I want to see a little bit of the blood where I have went kind of aggressive on her at her troubled areas, maybe around the eyes or around the mouth, even on the necklines and stuff. You do get a little bit of bleeding. What I have essentially done is I have tore off her barrier function of her skin. So right now she's got nothing on her skin holding the water in. So right now all of her moisture on her skin is just evaporating and leaving quickly. So now what I want to do is I want to clean her up and end up putting on a cream that she's going to put on for the next 24 hours until her barrier function is restored and her water is kept in her skin. So clients always ask me what they look like after microneedling. Essentially, this is it. She's done really well. She has a little bit of the pooled blood underneath the skin on the areas where I have targeted where her wrinkles are. Usually people are a little bit more red than this. Her skin has fared well, but it all depends on the skin type. You're going to be anything from this with a little bit of pooled blood to really red, kind of like a sunburn. That sunburn will last maybe 24 hours, sometimes 48. On day number 3, you get a little flaky. So just make sure you hydrate. I will tell you exactly which moisturizer to use. But all in all, she looks great. The only thing I ask is no working out for about 24 hours, no makeup, no powder, no foundation, nothing like that for about 24 hours. Sunscreen is such a huge, huge thing in skincare, and especially after a procedure like this, a physical sunblock is needed.
From our face to yours, we look forward to meeting all of your aesthetic needs here at Faces of South Tampa.